Uh, what are the important things that are outcomes that are important to your quality of life, if you could have any? What's number one?
Number one is to stop being so fatigued.
Tell me about the fatigue.
I wake up in the morning and I'm tired and I make myself get out of bed. I go exercise, I eat, and then I want to go back to bed.
You ran out of energy already.
Yeah, I'm done, and maybe by about late afternoon, then I'm ready to do a few things for a few hours, and then I'm tired again. So the fatigue is the biggest problem that I deal with.
And when do you go to bed?
I go to bed by midnight, and normally out of bed at maybe 9 o'clock.
So you get 9 hours sleep.
Well, I don't get enough sleep. I never get enough sleep. Sometimes I wake up with itchy ears, which is something I hadn't mentioned, or I wake up.
Something disturb your sleep.
Something does. And I just never feel rested. Never feel rested.
Okay. Thinking back, how long have you had this fatigue issue? Maybe up to this, not to this level. When did you first, thinking back, you had started fatigue?
Decades ago. I mean, it really started. I've had it for decades. It got really bad when I quit work, which was back in 2002.
That's 14 years ago.
Right.
So when you say decades, you're like in 30, 40 years?
Probably.
Okay. Thinking back.
I never seem to have enough energy.
Okay.
Yeah.
Okay. And in the last 12 years or so, you mentioned, has that been steady or getting worse or better?
It started getting worse again. It was really bad about 12 years ago or 14 years ago. And I look back now and I think what I was doing was pushing through a lot of times because I wanted to get things done.
Sure.
And I'm back to the point again where because I've had a back problem and neck problems, I need to focus on that. I'm back in physiotherapy, getting a rib block, and it's just, I need to do these things, physiotherapy, and then as soon as I've done those, I'm just exhausted. So it's kind of like body maintenance, and that's what my life is around, body maintenance.
Okay, all right, so that's the number one. And how's the fatigue affecting your quality of life? In what way?
I just don't have time, energy. I have 3 grandchildren that I'm surprised how little I see them, because whenever I do see them, I'm just completely exhausted for 1 or 2 days afterwards. I have a lovely little 2-year-old that's high energy, and I've sadly told my daughter I can watch him maximum 2 hours, and then I'm exhausted for several days. And I just shouldn't. When I was young, I was very athletic and was constantly on the go, and I just don't think that with my body in the shape that it seems like it is I should be functioning as poorly as I am.
And how old are you?
I'm coming up on 58.
58, all right. Still young. Okay, so that is, missing out is what you're getting at, right? You're missing out.
Yeah, I'm not seeing my grandkids grow up. I'm not getting to play with them the way I want to play with them. And then also, with my husband and everything, I just don't have any energy to go off and do a lot of things unless I push myself, which I will push myself, then I'm exhausted.
Okay, got it. All right, that's number one issue. What's the second one after fatigue?
The back.
Tell me about it.
I've got this area.
You can turn on a point if you want to.
Okay, I've got this area in my back that I often think if I could just have that area cut out and thrown away, then I would be perfect, but that's not the case. I'm having a rib block next week to take care of the inflammation and pain. It's been building up. I'm pretty sure this has been going on for over 14 years, on and off.
14?
Yeah.
Okay.
Well, actually, no, it's more than 14 years. Maybe 15 to 20. I'm not quite.
Okay, quite a while.
Yeah. I used to work in a hospital, and I think it may have been part of that.
Physical work of moving patients.
Just constantly physical, yeah. And So I am having physiotherapy twice a week for that. So that takes out my time. I just seem like I'm always going to doctors. And
When you said doctors, how many different kind of doctors have you seen over the years for various issues?
oh, I've seen cardiologist, gastroenterologist, rheumatologist. So I've gone through physical therapy, and my home is got I've got traction machines. I forgot to mention that. So I've got
You mentioned neck and back.
cervical traction machine. I've got a back lumbar traction machine. I've got all the physio equipment you can possibly imagine. TENS machines. I've tried acupuncture for neck, back.
Lots of things.
Yeah,
It's not for lack of trying. Let's put it that way.
yeah, right. It's like there's got to be something that's going to resolve this.
Okay. All right. Third one, after back.
Oh, the neck. Yeah, I've got neck and shoulders.
Mhm.
So just a lot of tightness down here, all the way up and down here to where I've had spasms, a lot of spasms, trapezius spasm, where my face numbed up completely. I've also got problems down this neck and here. I'm currently getting physiotherapy on my shoulders and my neck.
So right
and
side
my
more,
back.
right side more than left on the shoulder?
Right now, on the neck and the shoulder on the right side are worse.
They both, but right side is more so.
Is this the worse? And this is worse on the left side, back here. Yeah, it's just a constant.
Thinking back, how many years has that been a problem?
Again, well over 10 years, maybe even.
I think you mentioned
20
maybe
years.
20 years.
Yeah, 10 to 20, I'd say.
Okay, all right. Oftentimes symptoms don't stay the same. They either go up or down.
All right.
Have you seen a pattern or trend in the recent past?
I haven't seen any trends. It's just a matter of what I want to push through. If something's coming up, I've taken lots of ibuprofen, lots of paracetamol, Valium sometimes for relaxing, and just push through. So there's no pattern to it. It's just it's reached the point now where my jaw I can feel it, it's hot and it's inflamed and just very sore and achy. And now starting to notice shooting pain in my head.
So now we're talking the next issue, jaw pain will be
Yeah,
fourth one?
Right, yeah.
Okay, all right.
Okay, yeah.
So I know they may be all connected. Hope we are. We hope we can find a solution
That'd be lovely.
that resolves many things. That'll be our optimistic outlook.
Right.
But just so we can separate about the issues, the right shoulder part has been about how many years?
Right shoulder over 10 years.
Okay.
Again, yeah.
And then both sides of the right shoulder more so. And then the next one is the jaw pain. You went to the fourth one.
Right.
And tell me briefly about that one. What is the history on that one? How many years has that been a problem?
Oh, the jaw pains, ever since I was young, I've clenched, ground, had retainers, lots of bite guards.
You had some teeth taken out, I've mentioned.
I've had, 4 teeth taken out. All these teeth now are caps. There's several caps on this side.
You also have some missing teeth on the right
I have
side
a
lower.
missing tooth.
And tell me more about the jaw issue itself.
The
you mentioned-
numbness, I've got, right now I can feel it's warm and I can feel it's a little bit spongy compared to the other side. Recently found out that it seems like I don't have a condyle here.
On the left side.
On the left side.
And after all these years, you just recently, one of the doctors took a scan.
Yeah, right. So it's within the last 2 years, I think, or maybe 2 years ago, where he took a scan and came back and he was quite surprised that it seemed like the condyle wasn't there. he did make suggestions on different options for TMJ. I originally went to this dentist because I could barely open my mouth. That's right. How many years ago was that?
10.
That was 10 years
yeah.
ago. And he made me a bite guard that was one of the really hard ones for the top. And you called that anterior or something?
Front.
And to where it just, my back teeth wouldn't touch.
Mhm.
It's just where my
Yep.
front teeth did. Then that one broke, so he made me another one, very costly. And all of a sudden, like a year and a half ago or so, I just ached so badly here that I couldn't wear the mouth guard anymore. But then if I didn't wear the mouth guard, then my jaw would hurt in a different way. It wouldn't be my muscles hurting so much, and my teeth would start hurting. So I went to Kevin Caldwell.
So previous was Dr. Young, I think.
Yes.
Okay.
Yeah.
So you were under his care for about 10 years approximately?
We lived in England. Went back and forth, and this was part of the problem. And we tried to. It wasn't really fair to either dentist because we're going back and forth, and so we got dual treatment. So.
But you also had some, if I remember right, some specialists, national health care specialist.
Yeah, in England, I had. That's when I had saw a specialist about getting the implant put in, and I also had a crown put on in the back. I was given the option of taking out a tooth or having it crowned, and I just couldn't stand the thought of losing another tooth, so I had it crowned. But then when I had this recent bite guard, or no, I'm getting confused with my bite guards.
How many did you have in all, total?
I think
Give me an
I
estimate.
probably have gone through 8 in my life.
How many?
8.
8.
I would say
Okay.
over decades.
Over the years.
Yeah.
Okay.
But in the last 10 years, 3. 2 hard ones, no, 4. Yeah, it's 4.
Quite a
So
few.
I had one made in England, I had one made recently.
Which one helped you the most? Did any of them really help you a whole lot?
The one that helped me the most for a while was the hard one on top, because I had because I just had so much pain.
Gave you some relief.
I couldn't, it gave me a lot of relief, and I couldn't open my mouth very far. And that's the time that I had this trapezius spasm. That's right, and I think that's all
About the
connected.
same time.
And that gave me relief, and then he made me another one, and then all of a sudden it was really bothering me to where I just ached constantly and I couldn't wear it. Well, then when I went to the new dentist, because I lost faith in the other dentist, he pointed out it's because these muscles were hanging and constantly.
This would be Dr. Caldwell?
The Caldwell, yeah.
Okay. And he's the one that referred you to us.
Yeah. And he made me another one to protect my teeth, and that helped because I wasn't hanging, holding this out, or whatever it was I was doing with my muscles.
Okay.
So that doesn't hurt anymore. But then because I had the mouth guard in my mouth, because of the back of my teeth, I started fighting that at night, and now I'm in the state that I'm in now. Bite guards are not working. Bottom line,
Okay.
I've got to find something.
Okay. All right. Well, thank you. Anything else you want to add? Those are the top 3 issues that I know you have easily 15 more.
Yes, it's like, let's not go into all of
Okay.
them.
All right.
Yeah.
So if we find a solution for some of these, we're in good shape.
Yep, very much so.
Thank you.
Thanks.
It's a little more than a month since we started treatment with you, for you. Tell me briefly how you're doing.
I would never have guessed it. I feel absolutely wonderful. My life has turned around completely.
Okay.
A wonderful lifestyle now.
Okay. Tell me what you mean by that.
I have not had the kind of pain that I used to live with at all. I'm able to play with my grandkids. I'm socializing, probably socialized more in the last month than I had for over 2 years. I can actually make plans because I feel confident that I'm actually going to be able to accomplish those and follow through on those plans.
Yeah, I think you said on an email something about you volunteered to do something in the past, you're afraid to volunteer.
I wouldn't volunteer because I didn't know how I'd feel that morning. I knew that I'd probably be in pain, but I didn't know how much pain, and I don't like making commitments and not fulfilling them.
Sure.
So, but now my husband's surprised because it's like, okay, we can do that, and he kind of looks at me because he's not used to, he's actually never lived with me out of pain. So it's amazing.
Wonderful. Okay. The top 4 things that, as a wish list for you, was fatigue that you had dealt with for over 10 years.
Right.
What are the changes you noticed there?
I'm hot. I used to drag myself out of bed 9:30, make myself get out of bed, and now 7 o'clock, 6:30, 7, 7:30 at the latest normally. I'm awake, ready to get out of bed, exercise, and I think in the last month I've taken naps twice during the day, and again it's probably because I've been so active. Other than that, it was almost needing to go back to bed by noon for a few hours. It's a huge difference.
Yeah. Active also with grandkids, right?
Oh yes, yeah, spontaneously gone over and just picked them up on the day, and which I've never done. And they're 7 years old, and it's like I just never went over to say let me go get them spontaneously. So it was wonderful.
Wonderful. It's wonderful for them too. Spend time with grandma. So what percentage of improvement did you say in the fatigue?
Oh, the fatigue's 98%.
Okay.
And the 2% is recovering from the social activities.
Oh, that's well, at least you're enjoying them, right? Second one has with the back pain.
That's improved at least 95% too. The only time I used to take medication probably at least 5 days a week. Ibuprofen, maximum dosage 2,400 milligrams, and paracetamol. And in the last month, I've only had to take it once. 1 dosage of ibuprofen and 1 dosage of paracetamol that I can remember. So just unbelievable.
And you said it was when you're traveling or something.
And this was when I was sleeping on a lot of hotel beds, which I used to have to take my own mat, like a Tempur-Pedic mat with me in order to even get through the week, plus all my pain meds. And now I just don't. We got extra room for gifts.
Well, good. And you are also, if I remember correctly, had various devices. You mentioned your living room was like a physical therapy clinic.
Oh my goodness. Yes, I used to use
neck traction, back traction.
Right now and actually I only used my neck traction once this last month. Didn't use my back traction I used twice. My neck traction I think I used once. Probably should stick on the neck traction maybe once a week. That was Bob over at Physiotherapy recommended that. Back traction I just haven't. Like I say, twice, and I used to try to use it.
I mean, you have some injuries that you've sustained when you're working with patients.
Yeah, I'm pretty sure that's from my work in the hospital. I had problems, and I still have this, or I don't still have. I recently felt this pain in my back again, only because of the beds I was sleeping on. Up until that point, I'd actually even forgotten that pain was there.
You used to do the traction daily or something before?
4 to 5 times a week, probably.
I see.
Yeah.
All right. So that has to do with the back pain.
Yeah.
And what percentage did you say already?
I'd say 95%
Okay.
because it's only been 1 day that I've suffered this.
Third one was shoulder neck pain. That has also been 10 plus years of experience.
Yeah. Forgot about my shoulder pain completely in the last months. Forgot about that. The neck is possibly pillows again. I noticed this side has been bothering me more, but again, I think it's because it's only just recent, because we've been traveling, and this side is barely, minimal. So it's at least 95% increase.
Good deal. And the fourth one has to do with the jaw pain, numbness, which was the reason why you referred to me in the first place by your dentist, who saw your joint, one side joint is gone.
Yeah. Well, I used to be swollen up like a chipmunk, and I actually forgot about the numbness because I just haven't had any numbness. I don't have any pain. I can feel my bones. Nothing's squidgy. That word. So again, that's 99%. I'll say the only difference is I feel that I was clenching more at night on this side, which the adjustment may have sorted out.
Okay. And we check a lot of other things too, palpations and so on today. I want to find out what are some, I think you mentioned a few things on the email about general things. You mentioned about you used to take a laxative or something, not so much?
Yes, I used to take a Miralax to help bowel movements. I'm not taking them as much, except when you travel, things change, but taking a lot less of that. So it seems like, I don't understand why, but it seems like whether it's because I'm more active, so my body's moving more, but everything...
The body's in a sympathetic tone. It's not conducive with the gut to move normal. A body that's in parasympathetic, rest, relax, and repair mode is when the gut works.
Okay.
And a body that is always tense because it's in the sympathetic mode because you have balance and so on,
Right.
your body's constantly fighting, puts the body more in a sympathetic tone.
Okay.
And many times people have anxiety, which I know that was not your issue.
But it was.
Was it?
My anxiety level's gone way down. And
But
I just
those
feel-
go together.
Yeah, in my sleeping, I'm sleeping through the night other than I get up once to go to the toilet and then I go straight back to sleep. I wake up refreshed, which I hadn't for decades. So my sleep has improved. My pain's gone down. I don't take as many pain meds, which is another problem with your gut. And everything on that side is...
You mentioned something about balance, playing on a Wii Fit or something.
Right, yeah. Well, this Wii Fit is a balance where you walk, it checks, it kind of just as
It's a game.
little checking, where you see how balanced you are with you when you walk. I've done this for like 10 years now and never got 100% on my walking. It was always off 54%, 63% I think was the best. And I got 100% on it. It's like I was yelling, Donald, 100% on this walking one. I've never done this before. And plus the other games, I've really improved in all the games. So I'm assuming the balance is definitely...
Again, that goes along with the sympathetic tone, goes along with the anxiety. Your body's constantly fighting.
Right.
You're off balance.
Right.
Donald, you can speak up. What are some things that you noticed
Right.
about Stephanie?
Yeah.
Well, it's night and day to live with her. She's got a lot more energy. She's everything she said, I can 100% vouch for. It's a complete transformation. I really have to say.
He
that.
hasn't had this wife before. With where I'm just...
And I'm an engineer, so I've been very interested in the way in which the diagnostics are taking place, and how the actual treatment has been executed. And I think it completely resonates with everything that you taught us at the very beginning, has panned out. And she breathes more easily at night. If I listen to her, she can obviously breathe, so her airways seem to be better. I think you haven't mentioned is the ears as well. The itchy ears and the discharge, those have almost stopped, right?
Yeah.
I'm guessing you probably didn't expect response at this length of time. Because after you had gone with these issues for 10 plus years, many of them,
Yeah.
I'm guessing you expected, took a little while before you noticed some changes?
Well, I
If
know
any.
the first time you put the orthotic in, or the time I slept for the first time in decades. So the next day I was just crying all the time, and then it's just slowly everything has improved so much, and my energy level is just unbelievable.
Yeah, I meant before you ever started treatment. I bet your expectations were pretty low.
I said if you improve me 20%, it would be better, and I'm up at 95%.
But we've been to so many consultants, she's had so much physiotherapy done, trying to address all of these physical issues. And trust me, this was almost the last chance corrupt.
Because I wasn't going to do surgery.
And the British in England, the rheumatologist said, well, I know you feel like you're 70, but there's no physical reason for that. You're 50, but you feel like you're 70. So here I recommend these sleep treatments to give you better sleep, these pain treatments to keep your pain under control, and that's going to be your life.
Medications.
Medications, basically. And that's with the best. We've had diagnostics from CT scans and everything. This is really. But then, as I said, Dr. Rana, I looked at your video case studies, and that for us gave us enough confidence to come and see you. And,
no different in the U.S. British medicine is pretty high, and so is U.S. They're no different. I can tell you that.
Yeah.
But I'm so glad you're doing better.
Yeah.
I just want to get an
Thank you very
update.
much. Thanks a lot.
Thanks.